You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. Today's question comes to us from Terry Fletcher, who is the producer of the Codecast podcast. She is one of our online supporters, and we always appreciate her help with some of the questions that we have that come up with medical billing and coding. She is an expert medical coder. She has a whole series of episodes about different ways that doctors and hospitals and insurance companies actually use coding and billing services. I highly recommend you take a listen. Her website is www.terryfletcher.net/podcasts. Now, Terry recorded a question for me to answer, so let's have a listen.
Hi, Dr. Emron, and thank you for having me this week on Simple Health Radio. My name is Terry Fletcher from the Codecast podcast, and I have a medical question regarding Coumadin patients. When a patient is on warfarin or an anticoagulant therapy medicine, why is it necessary before they have a procedure, such as a colonoscopy or a dental procedure, or any procedure which actually would cut into the patient or possibly cause them to bleed? Why is it important to modify that medicine sometimes 3 days before that procedure to mitigate any risk to the patient?
Terry, thank you again for sending in that question, because it's very relevant, and there are a large number of people currently on blood thinners or people who have family members that are required to take blood thinners every single day. Now, Coumadin, also called warfarin, is one of the most common blood thinning medications in the world, so millions of people take it on a daily basis to prevent blood clots. So let me first tell you a little bit of history about Coumadin. Coumadin is actually a brand name. It's derived from a chemical called coumarin. Coumarin is an active ingredient that's actually used in rat poison. So it was used as a commercial pesticide for many years. The way that coumarin and Coumadin work is to block the vitamin K in the coagulation cascade. So the coagulation cascade helps the body to clot. For example, if you cut your finger, within a few minutes the bleeding is going to stop, as long as you have adequate platelets and vitamin K in your blood. So with Coumadin, it'll block the vitamin K, which means you can't form a clot. That's why it's a blood-thinning medication. Now, when people have a heart attack or stroke, that is due to a blood clot. So in those situations, we already know that that person's blood is a little bit too thick, and they are at risk of having another blood clot, another heart attack, another stroke in the future. So that's the reason why Coumadin is added as a blood thinner, to prevent the vitamin K from forming abnormal clots. Now, Coumadin has been used for decades as a blood thinning medication because it's cheap and effective. The dilemma is that sometimes it's too effective. So people who are on this medication or any other blood thinners often complain that they have excessive bleeding and bruising, even from simple injuries. For example, if somebody bumps their knee on the edge of a table, they may not consider that a serious injury. However, those people come to see me in the ER a few hours later because their knee swells up with a large amount of blood. It almost looks like they had a car accident or they fell from a ladder. Then we have to drain the blood, and it may happen again in the future from these trivial injuries. Now, people who are on blood thinners often have large bruises, especially on their abdomen, back of their arms, or any place where they get blood drawn. And they regret it because it looks awful. They have bruises all over their body. Cosmetically, it makes them feel a little bit uncomfortable. And definitely, blood thinners will save lives because they're very effective, but these are some of the downsides when the blood is just a little bit too thin, unfortunately. Now, there are people who've been on Coumadin for years, sometimes even decades, and they can still have side effects. Even if they're very careful, they do everything exactly how their doctor and pharmacist recommend. Those people, unfortunately, have spontaneous bleeding from their gums, bleeding in the urine. They may have bloody stools. They may get nosebleeds that won't stop, and sometimes they even have vomiting of blood. Now, if somebody is scheduled for a wisdom tooth surgery or shoulder surgery or any type of invasive procedure, the surgeon or the dentist want to avoid excessive bleeding. So in that case, the surgeon or the dentist will send the patient back to their family doctor or to a cardiologist, and they'll need them to be aware and to develop a plan of what to do with the Coumadin or the blood thinning medication. Now back to Terry's question. She asked, why do we stop Coumadin about 3 days before an invasive procedure? Why not stop it a day before or even the day of the surgery? Well, the reason is that it takes about 3 days for Coumadin to deplete the vitamin K. So remember, vitamin K is necessary to actually form a blood clot. When you start taking Coumadin, for example, on a Monday, you may not be able to deplete all the vitamin K until Wednesday or Thursday. So it's about 3 days later. Now, when you stop taking Coumadin, it goes in reverse. So the vitamin K will increase again, but that's going to take about 3 or 4 days. So that's why the family doctor, the surgeon, the cardiologist, the dentist, they need a written plan so that the patient knows when to stop their medication and when to restart it. Now, as soon as the patient has their dental surgery or their biopsy or whatever surgery they're scheduled for, the surgeon and the dentist need to know what to tell the patient. When do you restart your medication? Now, the dilemma is that someone who's been taking this medication or any blood thinning medication to prevent a stroke, there's a risk that during the surgery, when they're off that medication, they could develop a stroke, a heart attack, or a blood clot just by going through surgery. So there's a period of time where these people are considered hypercoagulable, meaning they're more likely to have a clot even if nothing else had changed. Just the fact that you take them off the medication, they have some anesthesia, they have a simple procedure, their body responds kind of in an abnormal way, and their risk of a blood clot is very, very high. Now, with Coumadin, there are some monitoring lab tests that are performed, and these are called INR or PT, also called the International Normalized Ratio or the prothrombin time. So these are technical terms, but most patients on Coumadin will tell you, I know what my INR is, I know what my PT is. Oftentimes they have to check it every month to make sure their blood is not too thin, but also not too thick. The dilemma, again, is that a lot of things interact with Coumadin, and these include things like antibiotics, anesthesia, and even green leafy vegetables. If you eat too many of them, or if you have a change in your diet, it can actually interfere with Coumadin, causing your blood to become too thick or too thin, and then you have problems on both sides. So you can see how a lot of different things affect blood thinners and the Coumadin specifically. Now, there are new categories of blood thinning medications that don't require you to be so strict. They don't require the monthly monitoring and lab draws. Some of the common ones include aspirin, Plavix, Eliquis, and Xarelto. You'll see some of these commercials on TV. The benefit of these medications is that they're easier to dose and you don't need frequent monitoring, but the downside is the cost to some of these medications. Not every insurance plan will cover them, and they're not approved for all of the conditions that Coumadin is already approved for. So every medication has an effect, but every medication has a side effect. And that's why you have to talk to your pharmacist, talk to your family doctor or your cardiologist, and if you need to be on blood thinning medications, just have an educated conversation with them, and then you can see what your best options are. So again, I want to thank Terry from the Codecast podcast. You can visit her website, www.terryfletcher.net/podcasts. I love to receive questions from my listeners so I can answer them on my show. It helps me to keep the content relevant and more interesting. Terry has already sent me another question, so I'm going to make a special episode about that for next week, but you can also send me questions by connecting with us on social media. You can visit our website, simplehealthradio.com, listen to the blogs, follow some of the links, and if you have information that you want me to share with my followers, just be in touch with me, and I'll do my best to share that as well.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.